Welcome to Shaping Healthcare, a podcast by CitiusTech. I'm your host, Laurel Rockle. Welcome to today's episode, where we dive into one of the most pressing and often overlooked challenges in healthcare: cybersecurity risks stemming from unmonitored and unprotected network-connected medical and other devices. Hospitals today rely on thousands of connected devices, but 87% of them go unmonitored. And with over 53% found to contain critical risks, the cybersecurity threat is more than just digital, it's clinical. These vulnerabilities don't just threaten data, they can directly impact patient safety and hospital operations. To help us understand what's really happening behind the scenes and what healthcare organizations can do about it, we are joined by two experts deeply embedded in the healthcare cybersecurity. Vipin Varma, SVP and Head of Cybersecurity Practice at CitiusTech, with decades of experience in protecting healthcare systems. And Leon Lerman, SVP and GM of Axonius Healthcare, a company focused on securing healthcare, IoT, and medical devices. Welcome to the podcast, Leon and Vipin.
Thank you. Hi.
Thank you. Great to be here.
It's great to have you. This is quite a big topic that we have today that we're going to dive into deeper, and really looking forward to our conversation today. But I think it's important to start with the big picture. Why are healthcare organizations increasingly becoming prime targets for cyber attacks compared to any other industry?
So let me start, and maybe Leon will have a lot more specialist input. So, see, the attackers go after where they can get maximum benefit, right? So that's the standard thing. No one will go after places where they can't get much from. And today's currency is data. And some of the most critical data is held by the healthcare organizations. It is not just data that can be duplicated. This is data that is very personal and unduplicatable, if I can call it that. That's not really a term, but so personal health records, uh, your parameters, any and everything concerned with a human is something that is very personal to them, and it is something that is something that you cannot duplicate again, etc. So availability of such data allows attackers to actually sell such data on the internet, and therefore everyone is all of them are after profits or after impact. So that profit aspect is one thing, the data is one part of it. The second major thing here is that healthcare organizations are often small, and the way that in the US healthcare system, the hospitals, and even the ecosystem that surrounds them, the medtech players and the peers, etc., very often they are smaller or medium-sized enterprises, and therefore they have a certain budget constraints and focus constraints about how they can protect themselves. So it's not always like a large bank which is able to better protect itself. Therefore, you will have them trying to protect themselves using a limited budget, but more so also most of their focus is very correctly on patient care. So you will find that uh, they are more vulnerable, they have more openings. The third major aspect is that unlike a lot of other industries, the the healthcare industry very specifically has a large volume of course, people, whether it is people who are servicing the patients or the patients themselves or the third parties which are providing services. So there is a huge ecosystem. But more than that, if you look at just the systems that are deployed to run healthcare, there is a tremendous variety of the systems, and that is something we're going to talk about today also, right? So all of this kind of leads healthcare to be one of the prime targets for a lot of the bad actors out there. And I'm sure Leon will come up with a lot more specificity about how many attacks have taken place, about how many organizations have kind of been impacted. But there is a large number of organizations that have been impacted, and this is only increasing. The type of attacks, the impact of the attacks has only increased. And the last point I wanted to cover is that healthcare is a very interconnected ecosystem, unlike a lot of other ecosystems. So it's not as if an attack on a small player is going to remain isolated. So very often, and this came up when the change healthcare thing happened, people said, "Oh, payment system is not going to impact patient care," but it directly impacted patient care, and that's where a lot of people got a wake up call that attack. I mean, and that is a very visible attack. That's why I took the name. There are lots of small attacks which are equally impactful, but here is where people realize that an indirect third-party attack could also greatly impact critical care for patients. So I'll just leave it at that, and maybe Leon can add more to it.
Yeah, I agree. I agree with Vipin very much. Just to add a couple of examples on the first point of the value. One of the assets that I think makes healthcare the number one target is the EPHI, the electronic patient health records. One of the issues with them is that they're not cancelable, right? So if a hacker steals a credit card and you find out about it, you just call your bank and you cancel it. But if they um, steal your social security number or any information about your medical record, that there's very little you can do about it, right? And then when they go on the black market and they sell it, then the value of the medical record is actually 10 times greater than the value of a credit card because of those facts, which make it a lot more beneficial financially for attackers to continue doing so. And also, as Vipin said, attackers tend to go where it's easy, as we say here, the lowest hanging fruit, right? And unfortunately, in healthcare, because the network is usually flat and interconnected, it's quite easy for them to get in and laterally move throughout the network. And also, with the proliferation of ransomware attacks, we're seeing that over 50% of the healthcare organizations actually pay the ransom because of the clinical implications, because a lot of those devices, like an MRI machine, we had a customer that had a ransomware attack on an MRI machine, and they could not use the MRI machine. And every minute that the MRI machine is not working, the hospital is losing thousands of dollars. They will pay the ransom to unlock, and we're seeing rates much higher than in other organizations. So attackers, seeing they're being successful, so they continue doubling down on their efforts. Unfortunately,
That's incredibly eye-opening, and just explaining it as you both have, it really makes it clear as to why healthcare would be such a prime target. Absolutely. I want to dig in a little bit more into something you were just talking about, Leon, is the uh, when we're talking about cybersecurity within hospitals and the devices, what kind of devices are we referring to beyond MRI machines? What is connected and why does that matter?
so I think today almost everything is connected. With especially when COVID happened, there was even a further acceleration as you hospitals need to give access to doctors from that connect remotely and nurses that connect remotely, and this is the IoT advancement. So it's devices like IV pumps, patient monitors, hospital beds. On the OT side, there's devices like elevators, smart robots that operate hospitals, even a Tesla. We typically in our deployments we see a Tesla that is connected to the hospital's network because it's parked in the garage, connects to the network of the hospital.
Wow.
Door locks, thermostats, everything today is smart and connected. And of course, this significantly expands the attack surface because typically those devices are more weakened. You typically cannot have endpoint security installed on them. For example, on a lot of the clinical devices, the manufacturer very explicitly says that if you install any sort of antivirus or EDR solution on those devices, they will revoke or void the warranty because it could interfere with the clinical function potentially, and they don't want to take any responsibility over it. So by definition, you cannot protect them the same way you can protect more of a standard IT device like a desktop or a laptop. Add to that a lot of those devices are running legacy and obsolete operating systems. For example, if you buy an MRI machine, you pay maybe several millions of dollars. You want to, as a hospital, you want to see the ROI, return of investment on this. So you want to keep this device for multiple years, and the update pace of those devices is very limited in comparison to other devices because of the clinical setting and all the different interactions. And vendors are being very careful and very slow usually on updating those devices. So you end up seeing devices still running Windows XP, Windows 95, Windows 311 that hospitals keep because they paid a lot of money and the devices work, and security is not always top of mind in comparison to the clinical value they can get out of the device.
Yeah. Can you dig a little bit deeper and maybe share some more real world examples of how the vulnerability in one of these devices could really lead to some serious consequences?
Yes. So there are some examples of attacks that happened. I will not mention any specific hospital names, just out of respect to those organizations. But I will talk about things that were published. So there was an attack in Germany where a patient died, unfortunately. It was an attack on the ransomware attack on the operation rooms. And essentially, all the devices, big portion of the devices in the operation rooms were impacted. Those were the monitors, the patient monitors. It was the different imaging systems that they had there, and essentially the operations room could not operate. And there was a woman that she had to take an operation. Right, those things have a very urgent way of like things. People need to take operations urgently sometimes, and once because the operation room was not working at that point, they had to divert her to a different hospital, which was like 45 minutes away, and unfortunately she died on her way to the hospital. So, some people think that a cyber attack, it needs to be like a Netflix scenario where, somebody hacks into a device and uses this device to cause harm. But in many cases, because in a hospital, every minute counts. So even if you create service disruption and a delay in the operation, it could cause fatalities. This is one example, and maybe another quick example I will mention. It's a research that actually we did as a company based on tag robots. Those are medical robots that are being used in the hospital. Essentially, they clean the linen, they deliver medications, and are becoming very, very common recently, especially in the US, but also in Europe and in APAC. And we found that through vulnerabilities on those robots, you can remotely connect to them, essentially take pictures of that. They have a camera. You can take pictures of the hospital remotely without being in the hospital. You can jam those robots to use specific elevators, so you can block elevators and you can basically control them. So you can move the robot to any patient in any room. So yeah, pretty scary stuff. But unfortunately,
Yeah.
that's the reality today with the connected ecosystem.
Correct. And just to put some numbers, Laurel, sorry if I can just add to what
Please.
Leon just said, because people think that there will be a few devices here and there, and from an impact standpoint, what is our ability to get to these devices and kind of compromise them so that you can launch further attack. If we take of course, he talked of imaging systems, and these are the big systems, and yes, there will be a lesser number of systems. There are lab and diagnostic equipments. There is the whole HVAC thing. If you remember this whole discussion about if you take our minds back 10 12 years back, it started with Target being attacked through third party, through HVAC systems, security systems. All of that is there. But just to give you an idea of the number of devices that are there in a hospital bed today, a normal bed would have at least 15 to 20 devices, and an ICU bed is upwards of 30 devices, and about at least 80 to 90% of these devices are network connected. So what it means is, if you have 1,000 bed hospital, please look at that multiplier. The second thing is, like Leon spoke about, most of these devices are, if I can say, custom or old operating systems, and they are, I'll not say they are easily compromisable, but they are more, if I can say, easy to compromise because they're very often legacy, right? So the point what I'm trying to make here is, it's not just, of course, we talked about the impact and the human cost, and the cost, not just a disruption, the inavailability, what Leon was talking about, but it is also the, from a point of view of, the attack surface, right? What is the ease of reaching these devices? That also is actually exponentially increased, because like I said, 30 odd devices per bed, 1,000 beds, that's the number of devices you have, and they come from a plethora of different sources, and therefore there is the need to actually inventorize, and the need to be able to see what is the status that we have of vulnerabilities and risks today, and to be able to take appropriate action to monitor and actually fix them, right? That's the thing I just wanted to make sure I we really, also touch upon. While some one or two things become sensational, it is also this whole opening up of the innards of the network through these. See, in a typical uh, enterprise today, you go to a financial enterprise, you go to even a healthcare enterprise, most of the critical systems and data is all on the cloud, locked away. There are lots of multiple layers of protection put in. But what is most easily reachable are the networks at the floor, right? You have, like Leon mentioned, a Tesla driving up into the garage of a hospital connects onto the network there. So they are the most easily reachable. They are very often totally flat. You have a lot of in and out. I talked about so many different actors, doctors coming in from outside, nurses, patients coming in, visitors coming in. So there is a lot of inflow and outflow. Those networks are very porous, and all these devices are without protection on a porous network. And that's why we feel that the risk is very high from this one particular vector. I just wanted to add a couple of these things.
And it's very important that you did. I'm glad you did, because between those examples that Leon was giving and that additional information, really driving home the importance of how, as you said, porous and how vulnerable healthcare organizations are, and how critical that is. Uh, and Vipin, I'd like to follow up with you. Are there any cultural or organizational barriers that make the managing of medical device risks
Right.
much more
See,
difficult?
I'll put that in two parts. The first part is taking over from what I just talked about, which is to say that, when when you ask Leon the question, how many attacks have, what kind of attacks have taken place and all that, invariably the attacks that come out, and become sensational in the news are some of the larger ones that have involved a lot of money and all that. However, there are lots of attacks happening on regular basis which we are not really aware about, right? Which don't come into public consciousness. So I'm just saying there's a lot of basis for attack there. And the reason I'm talking about this from a organizational, if I can say, culture and mindset perspective also, is that we often gravitate our attention to something which is top of mind, right? Which is sensational, which has kind of hit the headlines, if I can call it in that way. But very often, at an organizational level, attention is not paid to make sure that every nut and bolt is actually locked down. So one part of the, I'll not say the problem, but one part of the reason why we find that this is only now coming into prominence is because, there have not been that very large scale attacks, because the attacks have been quiet or small, and therefore they very often go under the radar, and therefore people feel that this is something that I can control. And very often, like I talked from a risk perspective, very often here is the where the risk is the highest. So that's one thing. The second thing is, very correctly, most healthcare organizations, most providers, hospitals, labs, various people, they are focused on their primary mission. Primary mission being saving patients' lives, providing care, right? And therefore, a lot of focus goes towards a lot of, and specifically from a technology perspective, a transformation perspective, infusion of new systems, AI, etc. The aim is to see how can I impact and improve patient care. Uh, what we need to bring a culture more and more is to make sure that the we can do it sustainably and in a manner which is secure. That's the second thing. The third thing from a culture standpoint also is, like I talked about, most of these organizations are small, right? And what that will mean is most people in the IT department, if I can call it that, or the technical support, are typically multitasked. They may, in some lot of cases, not be specialists. They may not have the deep background in cybersecurity that a lot of people, a lot of the teams in the larger organizations have. So very often they may not fully appreciate and understand what is the state of art and what are the requirements very specifically from a cybersecurity perspective. So that creates an environment where the right things, where the intentions are good, but very often the right things do not end up getting done. That's kind of what I want.
Yeah, and I will add from an organizational perspective, because when we talk about medical devices, those are not typically devices that IT teams are
Exactly.
aware of. In hospitals, we typically see a collaboration. There's a team called Biomed or HTM, Healthcare Technology Management. They're usually tasked with maintaining the devices, make sure they're up to date, break fix. And in many cases, they're also being told, okay, you're now responsible for the security of those devices because IT is only doing the IT devices, right? Desktops, laptops. But they've never done security. So there needs to be a collaboration between those two teams to effectively secure them, especially if you need to take any device level actions, like changing a configuration, changing a password. That those are not managed devices by IT. So that creates a complexity, especially with a lot of those organizations typically report to different departments. We're now seeing a trend that in some cases Biomed or HTM also reports under IT, and that creates a stronger collaboration. But where it's not, those are very disjointed teams, and that of course creates a challenge to effectively protect the environment.
And that is a very important point that Leon just made about who in the organization looks after that. And I'll just like to expand it one step further. Since these devices are from a lot of different manufacturers, OEMs, in many cases, when I discussed with the actual stakeholders on ground, they feel that the OEMs, and a lot of cases there is, these devices are being maintained by some of those OEMs then directly also. So they feel that the security of these devices also would have been looked after or will be looked after by them. And we talked about legacy earlier. We talked about various things. So very often these devices are not fully protected. Secondly, what Leon just brought about, which is that they are also unprotected because the way they are positioned on a network, right? And it is not just enough to protect at a device level. You need to make sure that they are being able to be protected the way they are deployed. And very often the actual solution lies in being able to segment networks, to make them less flat, to isolate devices, things like that, which is to be done at the hospital level. And like he was saying, right, there is a ownership gap between the OEM, of course, that is a separate part, but even within the hospital, the IT and the non-IT, the technical support, because who owns the network is normally the IT, and the devices are owned by the others, and therefore this whole ecosystem doesn't work as efficiently.
Both excellent points, really. And we've spent this time talking about the risks and the implications from said risks. So let's talk about some solutions. Leon, what are some practical steps that healthcare leaders and staff can take to better protect their systems and patients from these risks, especially, as you mentioned earlier, when we're dealing with these legacy systems that can't be patched or easily updated because of those manufacturer constraints?
Yes. So I think a couple of things. The first one is still a lot of organizations, provider organizations, have this mindset that this is not necessarily my problem. and they say, hey, those are devices by the manufacturers, and the manufacturers will need to solve this, and they need to do a better job, which they do, but it's definitely a joint responsibility. And if there is a cyber attack in a hospital, at the end of the day, the hospital is responsible for the patients, responsible for their data, and for their safety. So it is their responsibility. The second thing is that there are solutions, dedicated solutions for medical and IoT solutions. We offer. We're one of the companies that is offering this type of a solution that is network based, that doesn't touch the devices, as you correctly mentioned. A lot of them you cannot touch them, you cannot patch them, and for clinical reasons and for legacy reasons. Some devices, even if you try and scan them, like there's a lot of vulnerability scanners, they can crash completely just from doing a basic scan on the network. So providing a passive solution that can monitor all of those unique device protocols. For example, we cover over 200 unique legacy device protocols like HL7 and DICOM. The reason this is important because understanding those protocols really allow you to understand the devices and understand their communications, their behavior, what they look like on the network, and what is good versus anomalous in their communication. And then be able to do three things. The first one, and the biggest challenge I'm hearing from CIOs and CISOs in hospitals, is they say we don't have visibility. I ask them the question, how many devices do you have? And usually they say something like many, which is of course not sufficient to protect this environment. So providing full visibility and discovering all the devices and making sure you have this inventory or asset management of what you have is the first step. The second step is understanding the vulnerabilities. As I think was mentioned by you, Laurel, in the beginning, over 53 of the percent of the devices have at least one critical vulnerability. So it's very important to understand those vulnerabilities and correctly prioritize them to the most critical ones, to patient safety, service availability, and data confidentiality. And more importantly, once you have those vulnerabilities, take action, right? Just knowing about it doesn't solve the problem. In terms of taking action, we found that the most popular action to take is network segmentation, because again, you cannot touch the devices, the patch may not be available. And by doing network segmentation, essentially you're limiting the communication of the device only to the must-have communication. So all the rest, not needed communication, will be blocked. And to do that, you need to understand the environment well. You need to understand the ecosystem, who every single device needs to communicate with, in what way, at what time. And there are solutions that are able to do that very effectively today. And this is why this focus on healthcare and on medical and IoT devices is very important. The last piece of the solution is around attack detection. We mentioned that ransomware attacks and is very, very common because they're so successful, and because there's such a big number of vulnerabilities in a hospital. It's not practical in a short period of time to just cover everything. So there always will be a vulnerability. So you don't just need the proactive approach of taking care of the risk. You also need the reactive approach of assuming you will be attacked and make sure you have the tools to see the attack, detect it, respond to it, and stop it before any damage is done. So all those three pillars are available today, and I think every single hospital, every single provider, organization needs to have something like that to make sure that they are covered when such an attack will happen.
And just to summarize what he just said, so therefore know what you're looking to protect. So have a method or a means of being able to identify, detect, classify, and create a threat profile for all the devices that you have. Step one. Step two, for identify their vulnerabilities, the risk from them, create a mitigation plan. He talked of segmentation, various other things, patching, whatever you can. That's the second part of it. Create a vulnerability or a risk mitigation plan, execute it. And the third, as important and equally important on an ongoing basis, you know, integrate them into your overall threat management and threat visibility system. Possibly feed that into your SOC. Make sure that the SOC is able to see that vulnerability, not just from just getting the logs, but being able to know what is the alert that has been reported and what is the type of action that can be seen. So the make sure that those playbooks are created up in advance, and you are able to have a integrated threat response capability, including your IT systems as well as the devices that you have deployed. That's kind of it.
Excellent solutions and action plans, right? Absolutely. And Vipin and Leon, as we wrap up our conversation together today, if you could give one piece of advice to a healthcare CIO or CISO today, what would it be to ensure their organization's truly prepared for the next wave of cyber threats?
So let me go first. Leon
Yeah.
will add
Go
a
ahead,
better
Vipin.
story. So the first is recognize the issue. Uh, while there are a lot of discussions on various other things, topics, etc., there, recognize that this is a risk, and kind of make sure that there is a focus on this risk. Second, we talked about from an organization perspective, make sure that the you have an ability to plan for this. So cut across organizations or organizational barriers within your organization, so that you're being able to plan, design, and respond to threats from devices. So recognize the risk, cut through your organizational barriers to be able to design and plan for it. And the third is make sure that you have a forward looking view into, so whenever there is a device being inducted, or whenever you are kind of building up on the population, etc., make sure that you are able to build security in and risk management in from the beginning, from the step one. uh, Integrate all your ability to identify risk, mitigate risk, as well as mitigate risk on an ongoing basis into a standard in methodology, rather than looking at them in a discrete manner. These are a couple of things that I would like to recommend. Leon, sorry, over to you.
Yes, and I will add two things. I agree with great recommendations that Vipin made. I will just add that from an organizational perspective, it's very important to identify who is responsible, because if too many people are responsible, nobody is
Somebody
responsible,
is responsible.
right? And it's more important and more difficult to make, well, in specifically around medical and IoT devices, where, as I mentioned, you have the network team, you have the IT team, you have the biomedical engineering team, and things can fall between the cracks, and if there's no program defined, it will be very difficult to address effectively the threat. So this will be the recommendation number one. And the second one, from what we have seen, is that healthcare is very unique. It's unique in terms of the devices. It's unique in terms of the vulnerabilities that they have and the threats. Um, and I think a healthcare specific approach is very important. I know a lot of solutions out there. They cover it all and say that it's everything is the same, and healthcare is not the same. So I highly recommend to have a tailor made approach on the process perspective, but also on the technology perspective, to make sure that everything is covered properly and effectively, especially on the remediation side. On the healthcare end, do no harm, right, is the first principle. And a lot of those critical devices, if you don't have the proper healthcare context, when you get to remediation, you can break things, and this can create a lot of bad implications. So I encourage organizations to look for significant healthcare expertise when they pick um, an overall solution. It could be services, it could be the vendors, it can be the technology, it can be the consultants. They need to understand the healthcare business.
Vipin and Leon, thank you so much for your time today and sitting down with me for this excellent, but more importantly, critical conversation in cybersecurity. Thank you so much.
Thank you, Laurel. Thank you, Vipin.
Been a pleasure. Thank you.
The Shaping Healthcare podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.